Medical Dilemma.
Hi everyone, welcome back to Medical Dilemma. I'm Attorney Sara Suguitan, your host, and today we're talking about addiction medicine. To my left is Dr. Attorney Teresita R. Sanchez. Joining us also is Father Jerry Manlangit and our guest, Dr. Villaroman. Doctor, before the break, we were talking about detox and rehabilitation, and we've already differentiated that. But let's emphasize more on detox. I mean, aside from Bikutan, Doc, where do you bring your patients for detoxification?
We bring at St. Clare's Medical Center. Well, my private patients, I bring them at St. Clare's Medical Center.
That's why St. Clare is sort of unique in the sense that they do admit patients for
Yes, they do.
detoxification.
There's
Not all
6 floors.
hospitals do that.
Yeah. Well, it's important to understand that, especially with severe forms of addiction like in alcohol or opiate addiction, or even severe intoxication to methamphetamine, hydrochloride, and all other stimulants, you need to put them in a detox facility. A detox facility should be in a tertiary hospital with all the right equipment. Now, case in point for alcohol addiction, you develop severe withdrawals with alcohol. You see some people shake, they develop
Delirium
shakes, delirium
I
tremens. This is one of the few addictions where you can die from the withdrawal symptoms. That's why they need to be put in a detox facility. So that's well equipped. Sometimes I've seen patients of mine that were so severely addicted to alcohol that you have to really bombard them with a lot of benzodiazepines, but at the same time,
It's also addicting, which
it's
itself
also
is
addicting. At the same time, will depress your respiratory center. Now, one severe case I had went into full-blown status epilepticus, which is relentless seizures. We had to bring them to the operating room to put them in general anesthesia. To really,
nag-survive naman.
yeah.
Nag-survive naman siya.
Nag-survive. Awa naman ng Diyos, nag-survive po. But my point is, you cannot just do withdrawal management in any center that is not well equipped. You should never attempt to do detox management if you are not savvy, if you don't have the proper training or even the proper knowledge of what to give, what to do. Because a lot of doctors will make this mistake, and sometimes they refer it to us and it's too late. We have to be very careful. So a proper referral system is important. Now, before we put them into a rehab facility, it's important we put them in a detox facility first.
Yung iba nga nagtitipid siguro or for whatever, kinukulong na lang sa bahay. That's bad. Is that bad? Of course.
Not good at all. Of course, dahil wala ka naman control eh. Yeah, ano yun, very risky yan. Patients who are in, well, example, yung mga, hindi mo rin malaman kung may psychiatric problem to na magagamot naman, di ba? I mean, kailangan talaga makita ng specialista. So, the best thing is to do is to have a specialist see it, or a doctor who can refer properly to a specialist, and then, kung ano pang kailangan na gagawin in a proper setting.
Yes,
Doctor, with the volume of patients who are addicted into drugs, shouldn't the government be concerned about rehabilitating
the
them?
government, we are very lucky because the government is not only concerned, but they are taking concrete steps in helping all our patients. The Department of Health understands that addiction is a very vital, is a problem that has to be given priority.
Right.
In fact, we have the full support in Bikutan. We are very our heads are really supportive of our needs and understand. We incorporate all other yung meron tayo yung tinatawag na Millennium Health Goals, no? Ina-apply din yan sa substance dependence.
But if we have only that kind of center in Bikutan, about those on the Visayas, Mindanao,
We have as well.
Good.
The Department of Health has drug treatment centers that are all over the country. Yeah, in all 3, Visayas, Luzon, and Mindanao.
But actually, this at Camp Bagong Diwa, when did it actually start? Under whose presidency or what?
It was in 1972. It was established. Pinakauna kasi ang Tagaytay with
Right.
Drug
RA
treatment center.
RA 6425. it was under the NBI. The Bikutan was under then the military, the Philippine Constabulary, or the
So, panahon
Army,
pa ni
basta
Marcos to?
Armed Forces, and then
Oh,
later on,
72.
naging PNP na.
So,
Yeah, so
panahon pa ni Marcos, right?
1972.
Yeah, Marcos time, yeah.
Mm.
Marcos time.
It was already that rampant, no?
Well,
it was a serious problem.
Remember,
then
if
already.
I don't know, in the history books I read, no, about history of drugs in the Philippines, like when when Republic Act 6425 was enacted after 1081, our 8, Mr. Lim Seng, one of kilalang
yes.
drug
Yeah.
was musketeer,
Yeah, I
right?
remember now.
So
yeah.
martial law yan. Tapos doon na nag-umpisa matulungan na yung mga drug dependents because it was quite rampant then. Okay?
And worse now, I think.
Well, you also have to take into consideration
The source.
population.
Yes.
Pero ngayon talaga gumagrabe because there are more drugs. Doong araw ang number one drug of choice was marijuana. Now it's stimulants like methamphetamine. And this is not only here, it's global.
Right.
So it's become a very, very common or popular drug that's being abused.
Doc, you were saying na before someone who is addicted to drugs is treated as hindi ba parang prisoner ba?
Nung
You said
araw.
there was a change eh.
Nung araw. But you see with the new law, nakita mo yung 642, yung RA 9165, nare-recognize nila from what they write na ito'y dapat hindi hawak ng military. So, with 9165, all government-run treatment centers run by the PNP and the NBI were transferred to the Department of Health. Because they recognize na illness ito. Dapat ang nagmamanage ng addiction, hindi militar, hindi police, kung hindi, doktor.
Doctor. Has this also affected the practice of addiction medicine, this change in the law?
Well, nung araw, wala pang
Wala pa yung
forma na addiction
Sa bagay,
medicine.
oo,
Although there were
yes.
people who were helping, like some psychiatrists I knew, like the late Dr. Yat, who was also with St. Clare's Medical Center, started out helping also with addiction problems. But that time, we were not yet fully established as a specialty.
Yes, but there have been, I mean, the criminal side of those who are substance dependent, no?
Yeah.
should remain kumbaga, punishable under the law. I mean, we should not
Well,
stamp
the law is
that
the law.
out. Yes.
If you're
Yeah.
caught in possession of a drug or using a drug, there are corresponding punishments
Yes.
according to Republic Act 9165. But it does not mean that you go to jail. Now, it's different when you're peddling drugs or pushing drugs. That
Yes,
carries a much heavier penalty.
Yes,
And they are not
Manufacturing it.
supposed to be in a rehab facility.
that's
Oh,
right.
So the government is wise in telling us, ito ang dapat bigyan natin ng tulong.
I suppose it's similar to alcohol, you know, right? No, that if you take alcohol precisely to give you the courage to commit a crime, then that would be punishable.
Yes,
definitely.
you punish
It
the
would
overt
aggravate.
act.
Yes,
Aggravating
the penalty.
circumstances.
Yes, but if you've been
Or
taking it
mitigating.
routinely and you just by accident, because of that addiction, you committed something, would that be aggravating or mitigating?
Aggravating.
Aggravating
Yes,
then,
oh,
no?
still,
Oo. Yeah.
And in
Yeah,
fact,
hirap
for
Now
some
we have the new law, the drunk
driving law.
drug
Ah, yeah,
driving.
drunk
law.
driving,
I
which
forgot
includes the
the
RA so
Five
so so
numbers.
so.
Yeah, and yes, and 10075, but under that law, I mean, any accident, no, automatic you have to test a driver for
Do they?
alcohol. Yeah.
They
Well,
should.
supposedly they
We
should have
a
facilities.
breathalyzer.
Yes.
I read in
all
one of the
these
news clips, I saw in one of the news clips that there was an accident committed and tinanong ng police kung gusto niyo ba magpa-drug test. Siyempre, magre-refuse yun.
Oo.
Which
yeah.
I think counterproductive.
Oo.
Kasi
Kasi-
sa accident dapat kasi ano niya, automatic talaga ida-drug test nila.
Yes. I think
But
it
we're
was
still ironing
2000.
out
I
something.
think the states is something like that, no?
Yeah.
If there is an
Something.
accident
Yes,
or something like
Yeah.
that.
Actually,
that's
the
right.
the
Yeah.
blood level for the Philippines, if I'm not mistaken, is 8, the same as the United States.
Oo, yes.
Blood
oo.
alcohol level.
Otherwise, they would have to test you, no? Oh, alam mo, ang ganda ng law yun. That was passed 2014. But because maybe of lack of facilities, we don't even have breathalyzers yet. It cannot really be effectively
Well, I would
Fully
think
enforced.
a lot of
Pero ganda.
factors come in eh.
You
One
know,
is yung culture din natin, tapos yung lack of sustainability. Hindi na sustain yung
Pero ang ganda
implementation.
dyan, because as of now, when a driver accidentally kills somebody, a pedestrian or what, the most that they're penalized is about below 6 years, and you can still apply for probation. Kahit na namatay na yung tao, ha? But now with this, with the second huli, or then your license will be
Revoked.
permanently revoked pa. And that would be good.
Yes,
I
that will
think it
curb.
would,
It will
curb
prevent,
them.
definitely.
Oo.
Pero, what happens to them? How do we help them? Diba?
Yeah.
Yan
Kasi
dapat
kung minsan sila
nalalaman
rin
ng
yung
tao
drug
eh.
addicts, no?
We
Sila
should help them.
Sila rin yung driver.
I mean, as a doctor, as a physician, it is my duty kasi na kahit ano pang ginawa ng tao, he would have a chance at recovery to become a better and more productive person in the future, no?
But
Society natin.
definitely, they should not be behind the wheels. That's bad. you
Right,
really,
because
When they're drunk driving.
the danger will always be there, because if you are under the influence, certainly something can
Well,
always happen. Okay.
Duralex, Lex. Tama?
Duralex,
Lex,
Sedlex.
Lex.
Sedlex.
Yeah.
Are-
But I
The
just
law is
asked
hard,
doctor,
but it's the
no?
law.
I've said that, there are those who are addicted to drugs, but later on, as they say that those who are addicted to drugs will go into pushing drugs.
Yeah, because they have to sustain or they have to support
Yeah, right.
their habit. Some of them do that out of necessity. And then later on, because it's a lot of money, easy money, they get more involved, and then they go deeper and deeper into the
Right.
the trade. They get to know the more habang tumataas ka, lumalalim.
Yeah. oo. The
And
drug
kawawa
pushers
because
should
some of
really
them,
be
pag
penalized.
nahuli or medyo gumawa ng hindi maganda, they can be rubbed out, kawawa naman. So, what's the value of life there?
Right.
Yung drug pushers talaga should really be penalized. Yung
Well,
drug
the
users
law is naman
sometimes-
clear eh. I mean, they do that. Ang ayoko lang yung pagdating sa jail, they're treated like kings.
Yeah,
Because
and
they
it
still-
proliferates
Definitely.
still inside.
But I hope
Right.
with this new
They continue with their trade.
I think they're making changes now because nalaman na ng tao eh.
Oh, yes.
But,
it's been exposed to the media.
Drugs will always be here. Let's make
I
it.
think
It's worldwide already.
That's why
right?
it's because you can eradicate one type of drug, another drug will come out because human psyche, people are hedonistic eh. They will always come away from what's hurt, what's not comfortable to something that's more comfortable or masarap. Hedonistic.
Well, most countries do have drugs, ano? Sino mga drug-free kaya? Singapore?
No country is
Singapore?
drug-free.
No?
Even Singapore.
No country is
Taiwan?
drug-free.
No country is
No
drug-free.
country.
Yeah, that's
But there are some countries have more stringent laws. Like they have a death
And they
penalty.
Yes.
are effective, no? They put it to use, these laws.
Yeah.
Oo.
It's a matter lang of implementation, I think. Laws are good. Our laws are good.
Yeah, good.
And I think attorney would agree with me. Magaganda naman ng batas natin eh. Hindi naman mga tanga ang gumawa niyan eh.
Yeah.
Ginawa yan ng mga taong marurunong.
Pinag-aralan yan, oo.
Pinag-aralang mabuti yan.
Consultation,
It's just a matter of
stakeholder.
implementing it.
Right. Oo, tama.
Yes.
Implementing it.
So,
Yeah.
what else? How
Yeah.
about gambling? Briefly.
Gambling is also
How do you
can be
treat
also
that?
addictive.
How would you treat
Is it
that?
now
Well,
rampant?
the first thing we do is remove him from that environment.
the-
you know.
How would you do
We
that?
can put him in a detox facility as well.
With no
and then-
access.
Counseling. We do a lot of counseling, psychotherapy. Sometimes
is-
medications help.
What is your criteria for a certified gambler?
Certified
I mean to say,
a-
do
a
they have to
gambling
go
addict.
there?
Addict, yeah,
Addict, yeah.
addict.
A
Do they have
gambling
to go there
addict,
every
you don't have to
day?
go there. There's internet gambling as well.
That's
you know?
right.
You,
Yeah.
don't, you
As
can
long
you can
as,
be addicted to gambling and do your stuff in the comfort of your own home. Pag babad ka na sa utang, you get into legal problems.
Right.
Hindi ka na nakakatrabaho.
You're deep in debt.
You're not kumbaga nagkakaroon ka na ng gap with your family. Hindi ka na nakakapagsimba, for example, or something like that,
But with this gambling, is there a tendency to commit suicide? I mean, the gambler?
Well,
What
some
do you
people, when they suddenly lose a lot of money,
Right.
some will do that.
So-
Sometimes gambling could also be a manifestation of a depression or an underlying psychiatric disorder. That's why we need to hospitalize them also to determine ano bang pinanggagalingan ng gambling nito. May psychiatric or psychological problem ba to? Does this guy experiencing some forms of depression? Does he have substance addiction on top of a gambling addiction. I have a lot of patients that are addicted to methamphetamine and they gamble. They don't sleep
They might think that
So-
gambling is the therapy for his
because
addiction.
they don't sleep eh.
Because
Diba?
they're up all night.
They're
just
up all night, so
they-
they'll make sundo. They'll do drugs.
Just
So-
to, ano, oh my
So
God.
it's compounding and
Very
compounding.
complicated pala.
Complicated talaga. So you really need to put them in a
A
facility.
proper facility.
Shopping addiction, ganun din.
So same.
Internet
thing.
addiction, ganun din.
Ang shopping siguro, pag ordinary days lang. And you have a limit as to your cost. If you have no more money, you don't
So
spend
long
it.
as, so long as you,
Of
you,
course,
it's
titignan
not
mo rin.
detrimental.
Bakit sa
anymore.
They're
detox
going to borrow.
facility? Importante rin na
So long as not detrimental.
ma-screen mo rin yung pasyente for if you're like drug user, yung mga yung HIV mo, hepatitis
yes.
profile
Yes,
mo.
oo.
These are important also because the lifestyle dikit yun.
Mas maraming HIV sa mga drug users. No?
Well,
As a rule.
there are no clear-cut local studies yet because of the law of also on HIV, di ba may confidentiality and it has to be
Yeah, that's
voluntary. But nag-i-increase din yan. Kasi other studies in other countries show much higher, you know. So it doesn't make it different here.
Okay, Dr. Villaroman, and we've come to the end of the show, so we'd like to ask you to address our audience and this camera, please, for your closing message.
Well, thank you very much for inviting me. And basta we have to remember, addiction is not a criminal. It's not a. It's an illness. Okay, we should address it as an illness. So it should not be considered as something temporary. People who are addicted to drugs have to constantly be seen by a specialist. They should constantly be followed up. They should constantly be monitored. They should constantly be aware that they can lapse, they can relapse, and recovery is lifelong. So we are here, the Philippine College of Addiction Medicine, our hospitals, our treatment centers are all here to help you. And treatment will never be a punishment.
Thank you, Dr. Villaroman. Father Jerry?
Well, we know very well that we've got only one left to live in this world. No? We better take care of it, protect it, defend it, enjoy it, and do not ever take anything that is going to harm it in the future, because we are the only ones who are going to regret afterwards. So take care of your life.
Thank you, Father Jerry. Dr.
You know,
Sanchez?
having a drug addict in a family is very, very destructive, no? That's why what we want to do is to try to avoid, first of all, no one is immune to this addiction, right? The moment you try it, sabi ka, bakala ng iba, kayang-kaya ko ito, I will avoid it later on. Then they get hooked later on. So you can just imagine the havoc. I've personally seen some families with drug addicts, and it's terrible.
There you have it, ladies and gentlemen, addiction medicine right here on Medical Dilemma. If you or your loved one is suffering from this, then please consult your doctor. Thank you for watching Medical Dilemma. Tune in again next week for another episode.
Medical Dilemma